this segment. We've heard a lot about it, no skills. I normally hear something like, probably the word, what she's putting on is seducing me, like that. It's never an excuse. It has nothing to do with whatever she or he put on. I want to say that you actually practice or doing what you have in your mind. Sexual harassment includes many types of unwanted physical or verbal, sex, without a consent. No matter language you use in describing it, so far it is unwanted without the consent of the man or the woman, that is actually harassment, and it's very, very bad. Please, let's stop that. Let's desist from that. And individual too, we should be careful about the concerning the group that we move with, our friends, the people around, and make sure that you are in an open place with, especially when you are with the opposite sex, that you have been thinking, you have been, the way this person is looking at me, the way this person is acting. You just have to be open about any discussion that you want to have with that kind of person. The next week we promise to bring to you another topic on random bees. And this morning on our interview segment, yes, we've moved straight to the interview segment. We want to look at something that we all have to know about. We're talking about scabies. Scabies, is a contagious, intensely itching skin condition, caused by a tiny, I would say, mite. Scabies is contagious and spreads quickly through close physical contact in the family, school, or nursing home, just anywhere. And to be doing that, is an awareness, it's an opportunity to create awareness on the topic scabies. And to be doing that, I have a doctor in the house. Yes, Dr. Ibrahim Abayomi from the Department of Public Health for Ministry of Health and Inner Services. It will be doing justice to the topic to let you know all what you need to know about scabies. You're welcome, doctor.
Thank you. Good morning, viewers.
Yes, let the people at home meet you.
Thank you very much. Just like the moderator has said, my name is Dr. Abayomi Ibrahim. I'm from the Department of Public Health, Ministry of Health and Human Services.
Okay, you're welcome, doctor. Yes, we are talking about scabies. Am I right with that?
Yes, please.
It's a skin infection. So, just from you, let's hear from you. What is scabies?
Thank you very much. Scabies is one of the neglected tropical diseases that is that we find around us, and just like you have noted, it is characterized by intense itching over the body, and it's something that we need to pay attention to, because if an individual is infected in a household, it could actually spread within the house, within the household setting, and that makes it a disease of public health importance. So scabies is something that can actually lead to discomfort of the skin, as it is characterized mainly by infestation of this organism that results in intense itching. Thank you.
All right, so let's talk about the signs and symptoms to seeing somebody to actually, or we should talk about how to diagnose it.
or rather probably the cause first of all.
The cause.
Yeah.
Okay. The cause. The cause.
Just like I said earlier on, it is caused by a parasite known as Sarcoptes scabies. It's an organism that cannot be seen with the eye. It's a microscopic organism, a parasite. It's one of those organisms that is termed to be a neglected tropical disease, among other kinds of entities. So, however, there are actually two different types that has been known and established. We have the common scabies that is characterized.
So you've moved to the types, right?
Yes.
It has types.
Yes. We have the common scabies, which usually is characterized by intense itching and then with some form of rash on the part of the body that is affected. And once this occurs, the individuals may have discomfort all through the day. And the second type is what we call the crusted scabies or Norwegian scabies. From the name, we will know that what actually happened is that many of those skin rashes that we see, many of them have crusted, and therefore it makes them highly contagious, and then they can also be very discomforting in terms of the itchiness.
All right, thank you. You said this scabies is parasite and it's physical. Like, is it like a bed bug or what?
Yes, it's a microorganism, a parasite, which cannot be seen with the physical eye, except you scrape it up from wherever they are, and then they are, yes, usually from the skin, from creases of the body, like the wrists. You find them on the finger webs. You find them even on the palmar surfaces and on the soles of the feet. It can be on the arm. Sometimes we even find them on the scalp. And then in males, you find them around the genital area. And then in the female, they would sometimes hide in around the breasts. You know, there are clefts where they could easily hide. They actually form a burrow, right? A burrow, like they walk in a straight line. That's what we call mite's burrow. So they hide under the layer of the skin. That's where they live. So they're actually an ectoparasite as against organisms that are inside the body. These ones they live within the upper layer of our skin. So that's why they are called ectoparasites, because they mainly infest the skin. So it's important that they are dealt with, because they keep multiplying themselves. They lay eggs, and when those eggs hatch, they form, more mites are produced, and then characteristically by the activity they cause the characteristic itching that usually cause discomfort all through the day for anyone that is infested.
All right, so let's talk about the symptoms now, the signs.
Yes. Like I said, the characteristic of the scabies is the itch. It's intense. It intensely itch. Although the crusted form tend to itch more than the common scabies, and this is simple because the many of the transmission is skin to skin contact, person to person contact, whether you come in contact with the individual that has it, or even with the personal effect of the individuals, like the clothes of the infected person, because many of these mites must have been transferred to the clothing, even to the beddings of the individual. That is why prevention includes taking care of all the personal effects in the home, hygiene, clean everywhere, and ensure that they are not just swept everything, the entire room or the entire household, but you also take care of all those other things that the contact, the infested person has had contact with. Other kinds of symptoms that we see, of course, rash. And this rash could go from a purple, sometimes they can go to what we call nodules, right? So when you see swellings like this that are intensely itchy, you suspect scabies, and you quickly report to the nearest health facilities for confirmation. There are many other kinds of skin infections like that can actually be itchy, but the itch of scabies is very intense, very intense, and it's something that can be disturbing because it affects more of children and the elderly. So the discomfort is usually very much. Those are the common symptoms that it presents with.
So how can somebody now be diagnosed of scabies?
Yes, so if an individual has such a thing, it's better once you find that the skin is itchy, actually all the exposed areas of the body, like the extremities, the upper limbs, the lower limbs, the palmar surface, the sole of the feet is itchy, and then you find all those lines that we call the mite's burrow around the finger webs. Is highly suggestive of scabies. Such an individual needs to be treated, otherwise those mites continue to reproduce themselves. They lay egg and reproduce more of themselves, and then the vicious cycle of itching continues. However, the itching may not just happen within a few days. So there is usually a delay of itching. So sometimes when there is a contact with somebody who has been infected, there is need to treat that person as if the person has scabies. Why? Because there is usually a window period of days, or even sometimes it could run into 1 to 2 weeks before the individual begins to show the symptoms and signs of scabies. So
does it have stages?
Yes, like I said, they usually produce eggs. These eggs will hatch, and then they hatch into mites, and these mites, they continue to proliferate themselves inside, under the skin, under the layer of the skin. Yes, and then they continue to proliferate themselves.
So it will be like 2 weeks before it's actually manifest.
So sometimes within 7 to 10 days, before it takes about that duration before the symptoms can be shown. So in those who are not presenting with symptoms, we may still such a person can still have symptoms after maybe 1 or 2 weeks. So that does not show that he doesn't have symptoms. So anyone that is in close proximity with an infested person needs to be treated as well.
Okay, let's talk about the treatment. How is the treatment?
The treatment is available. That's a very good aspect of it. Scabies is preventable, and then it is treatable. In treating scabies, we haven't seen these symptoms that we have highlighted. It is important that the individual go to the nearest health facilities to see the professionals who are responsible for this treatment. Usually, for common scabies, there are what we call topical creams that can be used. These are creams that can be rubbed on those affected areas. Yes, and then those. It's not just curative; it also reduces the intensity of the itching, and as you know, those creams, those topical creams can actually kill the mites that we're talking about, but they may not have any effect on the eggs. So once you treat the mites, and the mites are dead, there might be a need for continuous treatment. Why? Because those eggs will still hatch and will produce more mites, which will need to be treated. So sometimes treatments can be prolonged for up to about 4 weeks, so you can ensure that all the mites have been eradicated from the skin. However, in crusted rabies, the crusted scabies, we also advocate that not just creams should be used, oral medications should also be used, because the kind of manifestation for the crusted scabies is highly intense, and it's highly contagious. In fact, it's more transmissible than the common scabies. So we want as much as possible to reduce transmissibility for the crusted scabies, as well as reduce the intensity of the itch. So we usually say that those ones with crusted scabies can use both the creams and then the oral medications. However, if in a community it has affected scabies had affected many households, or maybe it has gone on a larger scale to communities, that's calls for public health. It's a public health concern, so we want to it to be reported as soon as possible. We have surveillance officers around who will usually be notified, and they will report these cases, and then there could be a mass administration of the drugs for everyone in the community in order to reduce it. But like I said, emphasis must not be laid on the treatment alone, because the mites themselves are spread everywhere in the rooms as a result of probably overcrowding, or because those are the areas where we find scabies proliferating a lot. They can be found in overcrowded places, like where even in boarding houses, boarding schools, in correctional homes, even in hospitals, where we have maybe a highly jam-packed patients. So it can easily spread, since it is skin-to-skin contact, person-to-person contact mainly. So in order to do this, what we need to do and in terms of prevention now is to ensure that we take care of everything in the home that may have been contacted by the infested persons. The beddings of the infested person must be brought out. It must be washed thoroughly and dried in the sun. We advocate that if you cannot do a dry clean, you should use a hot water to wash those clothing of the individuals and the beddings of the individuals, and spread them where there are direct sunlight, or where there is enough where they can be dried to ensure that all those mites have all been destroyed. If the mites leave the body within 2 to 3 days, many of them actually die once they leave, because they need to be able to survive when they are on the skin of an individual. Yes. For any objects that are in the home that cannot be washed or taken care of, it is better that we isolate them.
I think this is just like coronavirus. Or what?
It's better we isolate them, maybe in a bag. Just put them in a bag and lock them up. If there are items within the household that cannot be washed, that the individual who is infested has touched or has had contact with, what we need to do is to put those things in a closed, tight container, maybe a nylon, open it and close it, and keep it away for at least a week when you are sure that all the mites that may be
What
there
about sun?
must
Keeping
have
it
died.
in the sun, can that do anything?
Yes, in the sun. It's also, I've talked about sun drying. Sun drying can also take care of
Take
it.
care of it.
Yes.
So,
Okay.
Is there anything you want to add?
I will just say that use of antiseptic is also important. Antiseptics, liquid antiseptics, antiseptic soap for bathing for the individual is also very important. It will also assist. Then we also talk about the use of antibiotics for those of them who probably must have, by the time the skin is itching and they keep scratching their skin, they peel the skin, some of them develop bacterial infections such as what we call impetigo. So they need to be treated with antibiotics as much as possible. So because there are other complications that it can cause, just like I mentioned, impetigo is one. It can also cause kidney disease. It can cause kidney disease, and the reason is because they produce toxins.
Probably when it's not well taken care of.
Yes, when the individual has not received treatment and it's protracted, it can lead to these kind of complications. It could cause heart disease, what we call rheumatic heart disease. It can also lead to kidney disease. There are so many causes of kidney disease. Parasitic infections like scabies is one of the known causes of kidney disease as well. So this is why it's important for us to take care of to immediately report all notifiable diseases, including
Where are they going to
scabies.
report, please? Is it in the hospital?
Yes, we have surveillance officers in all the local government areas. So what we need to do is go to the nearest health facilities at the basic or the comprehensive health centers and notify them, or even at secondary health facilities and tertiary health facilities. The person will get treatment, and as much as possible, will also contact our surveillance officers at these respective areas.
Okay, so after treatment, like how many weeks will the person feel well? Will they care and feel all right and live with people like normal?
Yeah, just like I said, because of the possibility of the eggs hatching after treatment, if you have treated the mice and the mice have been destroyed or killed, the eggs that are there are usually not affected by your treatment. So when you have assumed to have killed the mites, when the egg hatches and produces more mites, those mites will continue to proliferate. So you extend your treatment as much as possible. So minimum we say 4 weeks, 3-4 weeks. Some might even need to extend. By that time,
So
it
during
will
the
have
period, you need to be
For the-
drying all the time.
all the
like
clothes,
that, the clothes.
make sure you practice good personal hygiene, take care of your beddings and your personal clothing and other personal belongings. Wash them with hot water and dry them in the sun. If possible, you can even iron those clothing. A very high temperature will usually kill the mites. So that is what we advocate. And every other person living in the household, whether they are showing signs and symptoms of scabies or not, they also need to be treated.
All right. So, is there anything you advise to the people, or is there anything you want to add? Let them know.
So my advice to our people is, please, when you find anyone with excessive itching of the body, of the skin, please, whether or not there are rashes or not around the arms, the finger webs, around the digits, on the palms or the soles of the feet, or even around the breast area, the genital areas, or even around the within on the scalp of the head, or anywhere along the skin creases, the wrist, the arm, the upper limb and the lower limb, please let us take the individual to the nearest health facility for treatment. Not only that, also report it, because other people living in that household may also have it. So it will be good for surveillance officer to come and inspect the home, report the case, and possibly ensure that everyone in the household is treated, particularly those of them who may have had contact with the person that is infested with scabies.
All right, thank you, Doctor. The viewer at home, I'm sure you've learned one or two things. Even what you've heard it all what you need to know about this skin condition. Scabies, is caused by tiny mite. All what you need to do, you have to make personal hygiene your practice. Don't live in a overcrowded area. If you notice any case of it, probably this person is having this, has been itching for long like that, you can report the case. Please, once again, where are they going to report this?
Yeah, so we have outlets where we can report to. In the local government areas, please report to the nearest health facilities where our disease surveillance notification officers are. You can also report to the state primary healthcare development agencies where our NTD officers, the neglected tropical disease officer, is also available to take note and also do go out to inspect, and then to also ensure that everyone in the community that may have been affected is treated. Also, you can report to the state disease and surveillance notification officer at the State Ministry of Health, and the state epidemiologist also at the State Ministry of Health.
Okay, thank you. So personally, if you notice any symptom signs in your skin, please report yourself. The treatment too is not that hard. You just have to rub cream that the horror might say you are going to take. You've had it within a month, even less, you'll be okay. But let's take personal hygiene. Let's make it our practice. So before we go on this program, a very big thank you to our guest this morning, Dr. Ibrahim Abayomi from the Department of Public Health in the Ministry of Health and Human Services. Thank you for coming on the program.
Thank you very much.
I'm sure that people at home will stick to the advice, the prevention, so that we can all live peacefully. So the program continues with the next segment. Weekend Special. Don't go away. I know